Hi friends. So I'm already posted about these vital signs topics, some topics respiration and pulse and blood pressure. Sorry, respiration. So now the video is blood pressure video. So first you see that previous videos, vital signs topic videos all, and you should understood what is a vital signs, what is meant by vital sign. Okay, so now the video is blood pressure. So let's start the blood pressure video. So blood pressure, it is the force exerted by the blood against the walls of the arteries in which it is flowing. It is expressed in terms of millimeters of mercury. Okay, mercury, hg. Okay, millimeters mercury. And next, there are two types of blood pressure. So what are there? Systolic pressure and diastolic pressure. So what is meant by systolic pressure? Systolic pressure is the maximum of the pressure against the wall of the vessel following ventricular contraction. Then next, diastolic pressure. So diastolic pressure is the maximum pressure of the blood against the wall of the vessels following closure of aortic valves. Okay, so ventricular relaxation. So these are the two types of blood pressure. Then next, blood pressure is measured by using an instrument called bp cuff, sphygmomanometer and stethoscope. Okay, so the measurement name is sphygmomanometer and stethoscope and bp cuff. Okay, the average normal value is 120 by 80 mmHg for adults. Okay, only for adult. And brachial artery and popliteal artery are most commonly used, and it is measured by securing the bp cuff to the upper arm and thigh, placing the stethoscope on brachial artery in the antecubital space and popliteal artery at the back of the knee. And pulse pressure. So pulse pressure is the difference between the systolic and diastolic pressure. Okay, and factors affecting blood pressure. So what are the factors we learn? So sorry, and disease, age, heredity, blood volume, weight, diet, hormones, salt, caffeines, environmental factors, physiological factors, psychological factors, stress, anxiety, gravity, drugs, alcohol, time of day. These are the factors affecting blood pressure. And sites of measuring blood pressure. What are the sites? Upper arm using brachial artery, commonest. So upper arm, this is the one side, and thigh around popliteal artery, this is the second side, and forearm using radial artery, this is the third side, and leg using posterior tibial or dorsal pedis, this is the fourth side. Okay, these are the sides. We must remember this one, sides. Okay, so then next, a persistently high bp measured for greater than 3 times is called hypertension. Greater than 3 times, it is called hypertension. And that persistently less than normal range is called hypotension. And because of many factors influencing bp, a single measurement is not necessarily significant to confirm hypertension. And when the cause of hypertension is known, it is called secondary hypertension, and when the cause is unknown, is called primary essential hypertension. And what are the accessing blood pressure? So purpose, to obtain baseline measure of arterial blood pressure for subsequent evaluation, and to determine the client hemodynamic status, and to identify and monitor changes in blood pressure. And equipments, so what are the equipments? Stethoscope, blood pressure cuff of the appropriate size, and sphygmomanometer. Okay, and here stethoscope. Stethoscope, they are bell and chest piece, diaphragm, rubber or plastic tubing, and binaurals and air pieces. So these total is a stethoscope. Okay, and this is the sphygmomanometer. Here see how to check the BP, blood pressure. Okay, see the picture. And procedure to measure BP, blood pressure. Okay, so explain the procedure to the patient and remove any light cloth from patient's arm. Okay, and make sure that the client has not smoked or ingested caffeine within 30 minutes prior to measurement. And position, so the position on lying or sitting or standing positions, but always ensure that the sphygmomanometer is at the level of the heart. Okay, and with the arm supported and the palm facing upwards. So for example, patient is come to our hospital for the purpose of blood checkup, no, sorry, BP checkup. So which position you decided? You must decided sphygmomanometer is the level of the heart with the arm supported. So this is the position, sitting position. Okay, so the next one, apply cuff snugly securely around the arm 2.5 centimeter above the antecubital space fossa at the level of the heart for every cm, the centimeter, the cuff sides above or below the level of the heart, the blood pressure varies by 0.8 mmHg. And palpate the radial pulse. First, palpate, okay, and inflate the cuff until the radial pulse can no longer be felt. This provides an estimation of systolic pressure, and inflate cuff 30 mmHg higher than estimated systolic pressure. Okay, and next palpate the brachial artery and place the bell of the stethoscope over the site and the ear piece on ear. Okay, ear pieces, already I'm seeing stethoscope. Okay, so apply enough pressure to keep the stethoscope in place, and the bell of the stethoscope is designated to amplify, intensify low frequency sounds. Okay, and deflate the cuff 2 to 4 mmHg per second. The first pulse heard is the systolic reading. Continue to deflute until there is a change in tone to a muffled beat. This is the diastolic reading. And deflate and remove cuff roll neatly and replace. Okay, and record the systolic and diastolic pressure on vital signs sheet and compare the present reading with previous reading. Okay, this is the most important, compare the present reading and previous reading, and report or treat any changes in this blood. And clear ear pieces and of the stethoscope with antiseptic swabs and return all equipments. Replace all the equipments. So measurement devices, these are the measurement devices, see all. And blood pressure measurements, okay, measurement devices. And so this is the topic is blood pressure. So oral vital signs are completed. And so if you have any doubt, ask me, like comment me. And so thank you. So subscribe my channel and watch my all the videos. And anything is wrong, so comment me. And if okay, so stay safe and stay home. And wash your hands thoroughly with sanitizers. So eat healthy food. And so thank you all, subscribe my channel.